We have Dr. Maria Annette de Guzman Bautista. Okay, the talk is focused on the healthcare workers. So before that, I'd like to thank our sponsors. Okay, so we have UAP, Valuing Life and Breathe Freely, and of course, Novartis. Okay, Dr. Annette,
Good afternoon
good
to
afternoon, Dr.
everyone.
Annette.
Good
Okay,
afternoon, Dr.
afternoon.
Jude.
Okay,
Yes.
so
Mm,
nice to see you again, and thank you for again accepting okay our invitation to discuss the issues on one of the relevant issues nowadays. Okay, not only we discussed last time the mental health issues on the lay, so this time we're going to discuss mental health issues involving our colleagues. Okay, but before that, Ma'am Joanne, are we going to present a video, Ma'am Joanne? Okay. Okay, so and we're back. So, ladies and gentlemen, I'd like to present to you our very beautiful okay, speaker for this afternoon again, once again, to talk on mental health issues, Dr. Maria Annette de Guzman Bautista.
Pressure ako dun Okay, I'll share my slides.
Sure, Doctor.
All right. Okay. So this is my second time I was harassed by Dr. Jude Giang. But thank you, no? Thank you for the from the PCCP and Watson's page, UAP and Novartis. Because there are a lot of requests for lectures right now regarding mental health. So this is my second time and this is more focused towards the healthcare workers, no? Okay. I will just all right. Now, the year 2020 for healthcare workers talaga, ano ba masasabi natin? Kundi OMG talaga. So parang we were all caught unaware and not ready, no? So, the world of healthcare has been under heightened stress and it has been under heightened stress up to now. It's just that there were differences from March, April, and May that there's already that feeling na medyo nasanay na tayo. Okay. So this will not only include doctors, this also includes nurses, medtechs, our colleagues also with respiratory care, our radiologists, our radio technicians, and those who are involved in handling patients in hospitals or health centers. So no one was really ready. There were so many posts on I stayed at work for you or mga articles on healthcare workers because of the stigma. And you will always receive messages in your Viber, uh, Telegram, messenger about prayers, no, for your colleague. for your some healthcare workers who are critical or unfortunately have gone ahead of us, okay, because of this pandemic, sadly. Now, for healthcare workers, it's difficult because the factors are causing extreme stress can actually take its toll on our feeling of helplessness. Sometimes we're excited because there's something new, but nasusuppress siya by doubts. Sometimes we feel that we're inadequate as healthcare workers. No? Why? Because first is you're torn between the concern about being infected. So the first time that March came in, uh, I actually handle the administrative side of the COVID team. So of course, it's our pulmo and our infectious diseases and ER med who are our team. However, I am the one who tries to implement the rules, no, so that on board yung buong ospital. So you could see that it was difficult to find people to volunteer actually for this, no, kasi it's unfamiliar ground, no, it's something we don't know. The treatment was not even very sure yet, and it kept on changing. And there's also that physical discomfort nung una where you're asked to wear yung bunny suits. So sabi nila, huwag kang iihi. Pag ni-remove mo, so the infection came in and out by just donning and doffing the PPE. And then you can witness suffering and death, no? Na parang helpless ka, super helpless. And what's even more difficult is the long-term separation from your family. So, di ba, ang duty will be like 1 week and then may off ka 1 week or 2 weeks and then 1 week again. Okay, during the first few weeks, no? And then you would, by demographics, mas affected emotionally ang women. The women are able to express better than men. And then, so urban setting, those healthcare workers in the urban setting are more affected than those in the rural setting. Kasi ang daming tao, ang little na space, and the risk is higher. Now, what was the scenario then? You know, there were three aspects. It's the disease itself, having a very big risk of getting the disease and how highly transmissible it is, the pathogenicity, which kept on changing, and the treatment, all of which were not well understood no March, April, May, June. Then, ang dami pang pwedeng basahin that you don't even know which one's true or not. The protection, kakaunti ang PPE when you were in March, April, May. So that was a time that you should literally beg from people, and then we had to get all the mananahis in, I stay in Nueva Ecija, so in Nueva Ecija, all the mananahis had jobs, okay? Why? Because we had to be resourceful because we could not get sources for the PPEs. And the prices were skyrocketing, di ba, that time. And different kinds of masks came in. And in fact, we understand that some would post na hindi daw sila protected nung hospital nila because hindi N95 yung nabigay. But partially, parang naiintindihan ko rin because there was really difficult time purchasing N95s. It's not only being so expensive, but it's actually the unavailable N95 masks. So you had to improvise by using layers of probably the surgical masks and the KN95s. Okay. Then the guidelines kept on changing regarding lockdowns and what should be done and what should not. In fact, we got confused already with the ECQ, GCQ, modified ECQ. So to the point that people didn't matter anymore, no? Kung ano yung GCQ, ECQ, or what's the province having right now? Do they have curfews or not? Okay, because of these changes. Now, there are many situations that caused moral trauma. During the first few months, I'm sure it was an experience of all hospitals na nag-awol ang mga nurses, no? Most of them is nurse, no? Bakit? Kasi there are many reasons, no? The parents probably did not allow them to go back, and there's talagang scared of being assigned in the COVID ward. Okay. Now, the level of dedication at work also somehow decreased because it was overpowered by fear. And there were many somatic complaints. Diba, andyan yung masakit ang ulo, masakit ang katawan, madaling mapagod, hinihingal. And there was also a lot of blaming. Yung bang pagkakunyari medyo na short ng tao or medyo may nahawa na nurse and then kasi hindi ka nag-follow ng protocol, you know. So there was a lot of blaming because all of the people were at the edge, ang emotion sila. Konting ano lang nagagalit agad, okay? Now, these are sample scenarios of cases. For example, CD, an 80-year-old who was brought to the ER triage. So this was like March or April because we had a similar case like this with the difficulty of breathing, gasping na siya, and you actually know these are the typical symptoms of COVID, fever. So, uh, 'di ba, there was already parang there was already those regulations on not intubating, especially if ganito nakatoxic, and then you're going to consider other factors like this is a highly infectious disease. So the doctor, the nurses, those attending are torn between, okay, I can do something, but you know that this can really, really cause and everybody was not yet ready with all those acrylic boxes and all. So true enough, this patient died, and the wife was also positive. The patient was also positive. So these are common scenarios that happen. Na parang wala kang magawa. You feel so helpless. Another case is, for example, AB admitted at a regular ward. Okay, so dumating sa ER, na-triage siya, no fever, no cough. Okay, so maybe probably abdominal pain, headaches. Okay, had probably a rapid test that time. And then after 2 days in the ward, develops the fever. And then now is converted into a COVID suspect. So he's in a regular ward. So here comes now na sino ba yung nag-attend, the doctor gets panicky, the nurse who attended, the aide who attended, the janitor who attended, and the medic who got the blood. So, and yes, if he turns out positive, then now pilay na yung manpower because you have to test them and quarantine them because by contact tracing, that time hindi pa ready probably yung ward with precautions. That's why after all these experiences, andyan na yung changes that you have to wear a gown even if you're in a regular ward, you're not in the COVID ward, etc. And burnout, no? Parang nagiging masungit na tuloy yung natitirang staff because ma-overwork sila because they already lack staffing. And one of the causes sometimes of pasahan ng virus is also when you pull out nurses or staff from other wards. Okay, so medyo na-stop din yan for some hospitals during that period of time, especially earlier. Okay, so understaffed. Another case, no, can be like EF, a healthcare worker. So, nagjo-duty siya and develops a low-grade fever and sore throat, no, while on duty. So, part of you kasi low-grade fever lang, baka naman flu lang to. So, you're guilty also that you're going to be absent, but actually it's a requirement that you be absent for the minimum symptoms that may be infectious. But unfortunately, 2 days before, eh, dun sa area nila, co-workers, for example, they ate pizza or probably donuts, no? Just for a while removing their mask because we are social people. It's difficult talaga to live without people. So sometimes excited ka, okay, kumain ka. For that moment, and then nag-positive siya. So what happens, no? So all the other employees get scared. Naku, kailangan magpa-test, ma-isolate ulit. Kasi sa contact tracing, magkasama sila without masks. Okay? 2 days or 3 days ago. Another common case is, for example, like GH, no, seen at OPD. After passing a strict triage screening at the OPD, okay, akit siya, wala daw checklist, no fever, all right. And complaints of body pains, okay. Then, body pains and headaches. So, because hindi nga very specific ang symptoms ng COVID, this patient is similar to one I saw. And then I just gathered that may history of travel in an area medyo mataas. No? Sabi niya, sandali lang naman kami. It was just like overnight. And then on further prodding, nagbangko pala siya, and then may dinaanan pa, for example. And then, I just thought na maybe we should have a test, okay, done. He said he had a test for antigen. It was negative. Then after the test came out, it was positive. So these are scenarios that are very common. But at least ngayon, if you are wearing the mask and careful ka, hindi ka masyadong natitense because you followed protocol and the patient was also in a mask. Okay. So this is what we need to see. It's not exactly just protecting ourselves physically, but also mentally, because there is an extreme rise in the symptoms of anxiety and depression. And one of the most common drugs na hinihingi ng not only patients but also healthcare workers is, Doc, hindi ako makatulog. Okay? It's a lack of sleep. Some journals mention that some had an increased risk in the use of drugs. Drugs includes alcohol, maybe to make them sleep and relax, okay, and also sleeping tablets, and a rise of psychological symptoms and fear also of being infected. Now, what are the effects? Paranoia is very strong. Hindi yung paranoia na parang may naririnig ka or pinag-uusapan ka. Hindi eh. It's the paranoia of getting the coronavirus. So, if you have someone beside you na nagsisniff or nagsneeze, no? Oh my God, nandun na sa isip mo na, oh my God, nagkakalat to ng virus. Okay. But at the back of your mind, doon naman sa ikaw, if you're the one who has allergic rhinitis like me, no, it's so hard to control a cough or a sneeze, you know. So, kung talagang meron kang gano'n, tapos nakikita ka doon sa church, no, na nagsisneeze, ay nako, I'm pretty sure you know what they're talking about in their brains, no. So, it makes you so paranoid. Or when somebody gets into your office, no, hahawakan yung doorknob mo, di ba, panay clean mo, lalo na no first few months, okay? And another thing is loaded social media information on COVID. So, everybody has this sound ng Vipers, sound ng Messenger, or even in Facebook, no, or Twitters. You don't even know which one is fake or true, okay, among these messages. So, and that's why we always encourage people to make sure of their sources before they share, okay? Now, confusion also on what PPE is best, okay, especially during the first few months. So we started with bunny suits, no? Then eventually the WHO, DOH, and some other private organizations study that mas madalas talaga ma-infect when removing, because you're going to go to the toilet, when removing, donning, or doffing your bunny suits. No? So we went for gowns, no, which are overlaps, and then it transformed into social gowns. No? It para bang ano na siya, top coats, no? And then it designer coats or gowns. Then for the masks, no, you don't know which of the KN95s is the one that will filter most the virus. So ang dami-daming brands, and then the IATF and the DOH came out with the lists of the companies that are approved. But when you look at the ones that are with you, sa dami kasi ng companies, parang wala naman din dun sa list. Okay. So what do? You double it with another layer of surgical masks. Okay. Then even for the face shields, no, mas protected daw if it's covered from up. Okay, there was this heavy like trabajador looking shields, no. But what lasted more is the cheaper ones right now, which is like glasses that you wear. Why? Because it is light, it is cheap, and easily available. So, nag-transform talaga yung mga different kinds of PPEs. Now, another one is also having to deal with patients who do not tell the truth. Na. I believe that patients actually have that purpose of not telling the truth because they're also scared that hindi sila titingnan kasi. No? So from the screening triage, you're also scared of that feeling na masistigmatize sila. So that's why they will not admit that they have been to, let's say, for example, uh, abroad, or probably Quezon City, for example, na mataas ng incidents, no? So, or was exposed, no? Or probably they had a dry cough. they're scared, no? But it makes it difficult for us healthcare workers to assess them better. Now, according to the World Health Organization on mental health, it's normal to feel under pressure, no? So for you and many of your colleagues, no? And they emphasize that we should take care of ourselves at this time, having an efficient rest, eat sufficient healthy food, engage in physical activity, and stay in contact with family and friends. But it's easier said than done, actually. It's always read, pero ang hirap-hirap gawin. It seems so easy, but it's not. Some may even experience, in fact, not some, many, no, experience avoidance by family or community because of the stigma. No? Kasi galing sa hospital to eh. So mas takot sila sa atin. You know, nagdala rin kami ng mga goods, no, like for Dingalan Aurora, which is near our province. No, they had a very good system of screening people getting in because they're COVID free. So we understood that we had to go through that process even if we're going to bring relief goods, because baka even if we were doctors, baka kami pa magdala because it's in our area na meron and they don't have. Okay. Now, what are some essential coping strategies that we can do? Because remember, COVID-19 is a new territory for all of us and something we actually don't see. All right. Number one, it's routine, routine, routine. We are actually wired for habit. So we don't brush our teeth if we didn't make it a habit to brush our teeth. Para bang incomplete ka when you go to office that you didn't brush your teeth in the morning or at night. So because it was a habit, it is a habit. So routines become such an ingrained part of our lives. So if we have something new that we need to do every day, like for example, before leaving the house, you need to make sure that you have your alcohol with you, your PPE, your face shield, your face mask. It has to be a routine. After several weeks that you're doing it, nasasanay na. So, why are patients so difficult to teach sa pagsuot ng mask? Di ba? When you see patients wherever, no? When they start talking, they bring down their mask. Or when they enter your room, they bring down their mask because they're not used to it. Hindi naging habit sa kanila magsuot ng masks. Okay? So I tell them actually to practice wearing it even inside the house. Because like us, we're used to already wearing masks. No? So hindi na yung sobrang hingal when you wear it and you feel that you can breathe. Okay? Then staying home, the order which has been repeatedly said in all forms, okay, can be bewildering. If tayo kasi we don't feel it as much because we go out, no? We go to the hospital or we're doing errands like groceries. But for those who are staying home, like the elderly, the young, talagang nakakasakal, especially if you're staying in a crowded, small place like a condominium, which is barely like one room, no? Then recreate a sense of routine. So let's say you're from duty and then it's your off for 1 week. Okay, stick to the same meal times. Okay, choose a time of the day to shower and get dressed. So para bang it will still be an automatic thing, and exercise will be automatic if you do it every day. No, so it just doesn't mean you have to do all these workouts na mahirap. You can try downloading apps like that of MTC, which is the Nike Training Club app. It's only like 5 minutes to 8 minutes a day. And it's doable because it tailor fits it to your age and your lifestyle if you're sedentary. Okay. So at least 5 to 10 minutes a day will help you a lot, not only mentally, but physically. Reach out to your loved ones virtually. So, dun sa hindi toxic kausap ha. So, when you know na hindi sila busy, you form like a Zoom meeting just to have your friends and put some games, no? We do that, no? Mga co-neurologists ko. Then special rituals with children. If you have children, no? So you can do some painting, okay, or just cleaning the house or probably playing outside. Okay. Now, getting some fresh air. When you say fresh air, di naman syempre pwede tayo lumabas. But you can do it in a modified way by also setting the safe social distancing. So if you're in a room, open your window, okay? Para may konting hangin, no? And then you can take your call or video chat of your loved one in your balcony or in the garden so you have some sense of space. Remember, green is a color that relaxes the brain, okay? So it's nice that you view some plants, no? Kahit pa wala ka talaga outside, but at least you see something green, okay? Outside. Now, limit exposure, of course, no? So you have your trips to the grocery stores. It's Christmas, so I know you have some Christmas lists. Not all naman kasi online mo bibilin. So you just have to have the list with you so that when you go to the mall, alam mo na kung ano yung pupuntahan mo. Kasi if you're just going to look for the items there, so it makes you stay longer. And you'd be surprised at how many people there are. So if you know your errands, you can do it quick, fast by also letting yourself get out for a while, okay? Then do quick scans of headlines. Hindi kasi pwede tayong hindi mag-nanood ng news. But at least look at the headlines, ano na ba nangyayari, then after which you don't have to dwell on it, okay? So, extra tips, consider removing distractions like news notifications. Pwede kasi ninyo i-alis yung notification, let's for example, Viber, na maya nagtutunog because maybe you have 1,000 Viber groups, okay? So, you can silence the others, no, for a month or maybe 2 months, lalo na yung hindi ka naman very active. Para hindi siya tunog ng tunog, okay? Then think about an activity you can practice after reading news. So, let's say after reading the news, okay, time ko na for exercise or probably time to do my sewing or knitting. I don't know what you like, or probably listening to music. Embrace your inner home body. Okay, so there are many solo hobbies, no? Like reading. If you don't have actual books with you, you can download them. There are like Kindle and some WhatsApp. Okay, then sewing and knitting is one, especially for women, or old-fashioned tinkering. No? Yung bang kutkot tayo ng kutkot, you can actually fix your anik-aniks in your house, or probably taking a collection of music and making your own playlists. Okay, home projects like organizing your garage, no? If you would notice, no, marami kayong tambak, I'm sure, no? So just last week, we did some cleaning, no? So nakita ko ang dami namin mga electric fan na talaga hindi na pala talaga irreparable. So kumbaga dead na sila. So we brought all those junk sa junk shop, o di medyo kumita ka pa ng mga 3,000, ganyan. So you can sell them. Sort your drawer. So now is the best time because December, para sa January, you have leave some space and make room in your closet. So, huwag na tayo masyado magdagdag pa ng bibilhan na clothes because we don't even show it out right now. So, organize it. You can probably donate, although right now they're not allowing old clothes according to the DSWD. So probably you can just use those clothes for making collage look like, yung looking like a collage cover of your bed. Okay, so pwede yun, or you can make it basahans, no? To make use of this, no? Then some do garage sales. Okay, you deep clean your fridge, no? Yung refrigerator nyo, you would be surprised na may amag na ang ibang bote ninyo na nasa likod ng refrigerator nyo. So if you're going to clean it, sasabihin nyo, oh my God, last year pa pala to, or 2 years pa pala to, then it's time to remove it and throw it away. Probably you can reuse the bottles, okay? Or just simply wiping the ceiling fan. So baka ages na yon, 10 years na yung ceiling fan nyo, baka ang dust niya kasing kapal na ng something, no? Mga 2 inches na, okay? Some may go into yoga. Yoga, there is online yoga classes. Some are free for beginners and some are more difficult if you can do it. Some can do also journaling and writing. So you can actually use like a journal I have, which is a doodle notebook. So a doodle notebook is where you just doodle and write down some phrases or quotes that you like, in whatever way you want, or draw. It doesn't have to be pretty because it's yours. No, it's not there for display. So it's just your outlet notebook. Now, nourish your mind with positivity. Many of us now are into TV, movies, or online streaming, no? Like Netflix. Now, dahil medyo down tayo, no? Opt for comedies or feel-good dramas, mga rom-com, or even watching again the children's movies that are nice. No? I watched recently Nemo. Uh, I like Moana. I like Coco. No? Yun yung mga movies na gusto ko for children, which are actually also meant to be for adults. Also for music and books, uplifting genres that make you smile or laugh, not the music that will remind you of your exes and make you cry because of the memories that was brought about by this music. So go for music that is uplifting, or probably the music of Christmas, no? Right now, kahit na instrumental lang. And showing gratitude can have a similar effect, like asking yourself, what are two things I am grateful for in a day? Like for nurses, most often a patient would tell you, salamat po kasi ang bait-bait nyo, nakatulong kayo sa akin. These are simple words from patients that would uplift you and inspire you to even do better, di ba? Even for doctors, kahit pa ang ibinigay sa'yo, live chicken, no? So, you're still happy, no, that they're happy with your service, okay? Ask for help. There's nothing wrong in asking for help. You may seek help when needed. Connecting with each other, your colleagues, your friends, you should be quite keen also kung kunyari sa area of your ward, nakikita nyo na medyo mas tahimik yung isa, which is not her usual. A pat on the shoulder will be a big help, you know. And you may also seek help sa professionals, counselors, psychologists, or psychiatrists. That's why some groups are now forming helplines for this. Set up an employee association program. This may help. You may just form like a group, no? Probably a messenger chat group for the entire group or for each ward, no? Para naman nagli-link lang, especially also for the admin. And there are also national suicide prevention lines. Now, these are advices to isolated or quarantined persons. So one time probably in your 6 or 7 months, you have been made to be isolated or quarantined, no? So, when you're there, sa ganung situation, ngayon nga, mas shorter na eh. Hindi na katulad noon that minsan a month ka ika-quarantine. Stay socially close even when maintaining a distance. So, that's why we have our phones. That's why hindi namin inaalis na magkaroon ng link, you know, and internet in the rooms, no? Keep a daily routine. Kahit na sabihin mong isolated ka, okay, when I wake up, I'll have breakfast. Probably in a while, I'll do some painting, do crossword puzzle, or I will organize something, or I will type in my journal. Okay. Set goals and keep active, even if it takes extra effort when you feel down. No? It will take extra effort, but you have to do it. Try to force yourself because it keeps you distracted when you're active. Plan some time alone also, especially for the women, the mothers who are parents, no? And they take care of their parents too. And then they have young children. Sometimes kailangan din ng me time, no? Time to just listen to music, cry if you must cry, no? And just have some peace, okay? Another thing is using humor to lighten situations if it seems appropriate. So we had one nurse na, okay, he was quarantined because he was positive but mild, but he always went into TikTok, na and would make funny TikTok videos, and it inspires. Even if he doesn't realize it, it inspires many because nakikita mo na he's doing something na alam mo hindi ako magwo-worry na he's down inside alone, you know? Okay, maintain hope. Hope is always something we cling on because everything always leads down to having hope. Use stress management techniques like deep breathing, okay, listening to instrumental music, okay, and of course, accepting feelings when you feel down and anxious. You don't have to put up a mask na para bang I'm always like a superhero, I am Darna or I am Superman. No, there are weak points. We're not always on top of a situation, and that makes us normal and perfect. Okay? Now, this is a message no, for the team leaders and managers. It is very important to keep all the staff protected from chronic stress no, and poor mental health. So it's nice to just keep in touch, kumustahin sila, okay, in each area, whether it's a health center, a hospital, okay, or a small clinic space, okay. Ensure good quality communication, and of course always with good information updates, okay. Now also ensuring that our staff are aware of how to access mental health and psychosocial support, okay. So it would be actually very good for each area to have a psychological first aid, and responders are actually oriented on how to answer calls for these employees no. Manage urgent health and neurologic complaints. So there's nothing to hide about it, healthcare workers. So if you are suffering from depression, anxiety, or sleep problems, there's nothing wrong with asking no, with help within your hospital, and always ensure that there's available essential general psychological medications, for example, anti-anxiety meds or probably antidepressants if their need arises. Now, what is a psychological first aid? It is designed, it's like a tool designed to reduce initial distress caused by traumatic events, okay? And this will foster short and long-term adaptive functioning and coping. So maganda siya na for each area, like for each province, usually like the governor would like to have a hope line put up na meron talagang a-answer no dun sa line, okay? Now, ang hirap lang, there's a shortage of psychologists, psychiatrists to do this. That's why counselors and some people are trained, no? They undergo training to man the psychological first aid for each area. This fosters also caring, empathy, and actually active listening. Di ba the mere fact that nakaka-ventilate ka already relieves you half of the time, no? Konti na lang ang dadagdag pa doon. Now, not only healthcare workers would benefit from a psychological first aid, also the self-quarantined persons, social workers, people who recover from COVID-19, families and friends of those who have died of COVID, and groups with previous vulnerabilities kasi may history na sila before, may depression or anxiety. Okay. Now, I'm down to my last two slides. Always remember that the basic attitudes towards the pandemic are four. No? It's being still. No? Kalma lang. Kasi even if we put things in our brain no na hindi naman controllable, okay, you know that it's not controllable whatever you hear in the news no, the blaming of each other in the news no, the increase in the number of cases, wala naman tayong magagawa, di ba? So I just screen what I read, I look at the headlines, and I don't like to sausaw, no? Ayoko nang makigulo dun sa mga arguments in Facebook, okay? Trust, okay? Trust your day. Whatever religion you have, you entrust it to Him by praying, no? Just a short prayer of entrusting, because if you give your full trust, it relaxes you. And when at the end of the day, you just be thankful for surviving that day. Now, this last slide is my favorite quote, which I put in my journal because it's very relevant. Worry will not strip tomorrow of its burdens, but it will strip today of its joy. So kung magwo-worry lang kayo ng magwo-worry within a day, no? Hindi mo na nagiging maganda yung relationship mo with your kids, with your family, because you're, oh baka mahawa kasi si ganyan, o bakit hindi ka naghugas ng kamay, or bakit ganito ganyan. So at the end of the day, no, nawalan ka na ng joy, wala naman din actually nangyari. Nobody can predict when we're going to die. As I said in my first lecture, for example, Kobe Bryant never knew he was dying at that day na babagsak ang helicopter niya, right? So, let us just relax, pray, and see the beauty of each day as it passes by. Thank you very much.
Okay, thank you very much, Dr. Annette. Again, syempre, high yield ang iyong
Short lang.
lecture.
It's just
Thank you very
short.
much for that very wonderful lecture on how to cope, no, with the what's happening right now in our
Mhm.
environment. Okay, so I'm sure all of our listeners uh, gain a lot, no, from your lecture. Okay, so but before I'll start and started asking questions, I'd like to acknowledge some comments. No, there's a good comment here from one of our viewers, from Mr. or Dr. Jose Luis Santos. He said that the tips and advices are applicable to regular busy professionals, and examples of Dr. Bautista are so realistic in the Philippine setup. Okay, so thank you very much, Mr.
Thank
Santos,
you,
for that.
sir.
And papahabol pa pala siya, no? It's true, no? Emotional ventilation helps a lot, but you have to choose a listener, a good, okay? And nice quote doon sa ending. Okay, thank you very much,
Yeah,
Mr.
I love that quote.
Santos. Yes, okay.
Mhm.
So, Dr. Bautista, or I call you na lang Ate Annette.
Yes, Kuya
So,
Jude.
in your first slide, so you mentioned the what do you call the factors to cause extreme stress, right? So, which among those factors you think have the most significant impact with regards to the to us as the healthcare workers?
The stress all relates to the virus. No, I strongly believe that they're all connected, from getting the virus down to actually loading yourself with online things. No, so it boils down to the uncertainty. It's the uncertainty as to hanggang kailan ba to, as I asked you a while ago, we both teach, no, so para bang part of you now appreciates that I'd rather have a face-to-face teaching than doing online. Okay, but yes, it comes with the convenient thing that I don't have to go to the university. Now, for hospitals, for example, for a while, humiga lahat ng ospital, hindi ba? The number of patients that, especially surgeons, no? Cases who would come for an elective surgery during the first few months, no? Because the scare is still there. In fact, until now, it's still there. No? But for my field, baliktad, dumami siya. Why? Because of the anxiety. They could not handle the anxiety. The patients have the difficulty. They fear that they're going to lose their minds. Okay. And they feel that people don't understand them. No, they feel like they can breathe. May headache sila, all these multiple concerns. And I'm sure they go to pulmonologists because they have, nahirapan po akong huminga.
Huminga.
Parang hindi pumapasok yung oxygen. They're gonna the ER, for example, na gusto nila kasi, and the psychological effect of just putting the oxygen, actually, bigla sila marirelieve. Okay. Why? Because it's anxiety driven. No? Hypertension can be anxiety driven, right? Why? All of us are scared. All of us are scared. So sometimes the patience of the doctors then is tested to the limit also. So all of these, no, are related to our fear of getting the virus, our fear of an uncertainty that we might die, and we might pass it on to our relatives. No, but right now, like for example, I've never stopped face to face actually. So because in our area, signal is not very good. Not all people have online access. So we do face to face, and I am used to wearing uh, PPEs, no? I'm used to wearing a mask, okay? And di ba we have this acrylic boxes already and all.
Yes, oo.
Yes, and I already put a microphone because they could not hear me. Okay. But you know what, as Dr. Luis, as I remember, said, it takes a good listener. No, if you listen to them and let them talk and ventilate, half of their symptoms disappear already even before you go out of the clinic. Okay, then that's the time you talk to them and then they are reassured. Okay, it matters. So right now it's our talking skills and listening. Actually, it's the listening skills that will matter. No, even for any field, the nurses, the med tech. We had one patient, no, well, she's a medical professional. Okay, so she texted me appreciating the medical technologists who took extracted blood, and she was COVID positive. And then sabi nga niya, I appreciate the smile of the medtech beyond, you can see it kasi in your eyes, di ba? No? Beyond
Yes,
all the
oo.
masks, that she was even humming. No? Na parang it relieved her na parang hindi ako pinandirian. In fact, she was the one who's shooing her away to to go na para hindi ka maano. But very calm yung medtech. You know, she was protected naman kasi. So you could see na how much a smile from your eyes will matter to patients. No? But tayo, from ourselves, no, we have a lot of nurses who are very anxious right now. No? Pero isang tap ng shoulder sa kanila, laking bagay sa kanila na sinabi mo, uy, okay lang yan. Iyak mo lang. Hindi yung kaya mo yan lang. Naku, pagka ganyan na. Para bang
Nag-training ka
toxic
nga eh, di ba?
positivity. Oo.
Oo.
Yes. So, we don't answer them that way.
Yes,
Oo.
okay.
No?
So do you think, Doktora, yung attitude ng mga healthcare workers today,
Mhm.
iba na, nagbago na from the time that this pandemic started? Or medyo nagdi-dwindle pa rin?
Okay. From the start, the scare is less right now. Because you can survey from those, like, we cannot avoid once in a while merong mai-infect talaga na frontliner mo. But when this frontliner got sick around September, October na, sabi niya, Doc, hindi ako masyadong takot. Mas takot ako kung March. Okay, ng April. Because ngayon, medyo, kabisado na nila. They know, they're confident, na medyo alam na yung gagawin. Okay, so that attitude is towards the illness. But attitude of the staff, okay, healthcare workers, doctors in general, are more positive right now. The first few months, it was very difficult to get volunteers, no, to man the ER, to man the COVID ward, no. So you have to be like really Miss Congeniality to get to convince, no, these nurses to really come front and become heroes. Sabi ko nga you will be heroes like 10 years from now when you discuss history. You are part of history. Parang it's a revolution lang yan eh. Diba?
Okay.
So, but it was really hard even for doctors to get
Yeah, so I think
doctors.
there was a time na, paano ba sabihin yun, yung package, parang ganyan, just to invite mga, what do you call this, yung mga moonlighters, di ba, no? To man the ER, okay? So I think it's very difficult
Yeah.
talaga, okay?
It came to a point talaga na consultants. We had, ang maganda naman kasi, the medical staff can be very cooperative. Na we had first liners, second liners, then yung
Yes,
mga tanders nandun na sa third liners. No? So parang gera. No? Yan. But you are also providing utmost protection. You know? Kaya nga talagang nagpatahi kami talaga ng marami because we could not get the sources, no, from
yes,
Manila.
during that time talagang
Yeah.
parang everybody's up for grabs, no? Agawan,
True.
hoarding, etc., etc.
Super.
Okay? So ngayon, pagpunta ka sa supermarket, marami na alcohol.
Ay, super nga. Mura na
Mura na.
KN95. Yeah.
Mura na. Okay. Correct me if I'm wrong, Doctora, that women are more vulnerable for mental health issues,
Um,
even though they are
you,
more expressive.
yeah, they're more expressive, but they are, let's say, not vulnerable. Kasi mas emotional ang women, no? And remember, sorry, lalaki ka, but yeah, multitaskers kasi, mas multitaskers actually in females, no?
Or sila rin yung nagko-comprise ng workforce.
Yes, no?
Oo.
And then they're married, We have kids, we're married, no? And then para bang all the organizing in the house also depends on usually the mom, no? And parang mas marami kasing ginagawa talaga ang babae. So emotionally mas pagod sila, mas tired, no? And then you have little kids na biglang modular and online, and then you're from duty, and then you have to take a bath, and then you have to sit down and check on their assignments because modular nga. So you have to look for a tutor. Takot ka naman papuntahin yung tutor, 'di ba? So there's so many issues, no, na kailangan na dalhin. That's why they're more vulnerable. But on the other hand, they are easy to express, no? They're the ones who will seek help more than the males. Pag yung males medyo pag malalim na yung depression, then that's the time they seek help.
Uh-uh. So that's the reason why males do not, I mean, the daddies do not volunteer na mag-online classes with the kids.
Hindi sila as patient kasi sa
Oo,
ganyan.
oo.
No? Oo.
Okay. Doctor, you mentioned about online classes. Now, what about doctors who are professors who teach also? Does it add to their mental health issues? Parang ganyan?
Yes,
You
super.
know naman yung iba ngayon yung meaning all of us are not used to, di ba, sa online. Siguro pa-on-off ng computer, laptop, pero yung the whole day you're in front of a computer, you're making examinations, ganyan.
True.
So,
Mhm.
plus the fact that na meron pa mga patients, di po ba?
Oo, tama. Correct. Yes, it's true. This is adding so much burden, no, on doctors, no, who are teaching. Why? Because let's say you're in the generation who has not been exposed with too much technology. So it takes a while before you get the hang of it. But it doesn't mean that if you're 50 or 60 and above, you will not learn it. It's just the speed that slows down, but the learning process is the same. You can still learn it. Kailangan lang wala tayong nakalagay sa brain natin, hindi ko kaya, hindi ko yan kaya. So, if you get used to the Zoom, ngayon nga, sanay na ako mag-share screen, di ba? So, ayan. Yeah. So, like, ang problem lang with teaching though online is you're like walking in an egg crate, no, full of eggs, because you could not actually gauge if your students are learning, all right, or are they not connected, or are they listening or just online and then nakamute. So for small classes, actually I require them to show their faces. It doesn't matter if their hair is long, if they're in pajamas, na wag lang naman yung obscene. But I'd like to put names, the faces on their names, no? So I want to get to know them more because I only teach like for small groups. It's just small group discussions. So it's more interactive. Kasi kung hindi, you don't even know if they're listening or not, no? And sometimes, no, madali rin kasi silang mag-complain if, let's say, you make it too hard, no? So ngayon, medyo ang patience mo must be stretched, to give a wider understanding for them, because it's really difficult because some areas will have poor connections talaga online. Yun nga lang, you don't know if it's real poor connections or yun yung mahirap, no?
Okay. So adjustment is really very important, especially
Yes.
for us no teaching in the
Mhm.
faculty, no. So for the a little stretching goes a long way, di ba?
Yes. Kaya lang nga, it's borderless. Parang wala kang border between home, clinic, and school, because you extend your work while you're at home.
Yes, I agree.
So that makes it so depressing.
Especially those how to call this meetings, di
Yes,
ba?
true.
Society meetings,
Mhm.
staff meetings. Sometimes it's scheduled to 7, 8, di ba?
Mhm.
So parang
Yes, I
dagdag
agree.
stress, paging,
Dagdag stress, super.
paging.
Paging,
Dagdag
paging, limit
paging,
na nga
paging.
meetings.
Paging. Ate Annette, we have one question here no, from
Mhm.
Maribeth Santos.
Mhm.
She's asking na, uh, what's the effect I mean, yung, for example, a family member who get infected with COVID. So,
Mm-mm.
yung stigma, no? So, yung effect sa family members.
Okay. Siyempre, within the family pa lang, nagkaroon ng one family member, whether it's the healthcare worker or not, no? Andun yung mahal mo siya pero scared ka, 'di ba? So it's like a toss up between guilt, no? Feeling I might get it too. So what do? Magkakaroon ngayon kayo ng isolation within that house, no? So hangga't kakayanin, that's what you're gonna do because you don't want to be put in a quarantine center, right? So in the LGU. So first is dapat may plan kayo. Let's say hindi pa nangyayari. May plan na kayo. Okay, if one of us will get infected, step one, kunyari, the father of the family gets infected, meron kayong planning. Okay, so this is what you're going to do, eldest of the children, o ikaw ang magti-take over, ikaw muna sa budget, ang ganyan, kasi itong room na to will be reserved for for the person who will get sick. So para bang meron kayong planning para when it happens, hindi kayo nabibigla. That is always what we recommend lagi. When I tell healthcare workers sometimes, no, na dapat meron na tayong plano para in case may room talaga kayo. If not, we accommodate, for example, in the hospital, meron talagang ward that where if the healthcare worker gets sick, we admit them. No? Para hindi na siya nagwo-worry din doon sa family niya. And of course, because positive siya. You know? So, yun yung we watch out. Baka mag-pneumonia or something. So, meron kang protective thing within your workforce and to protect your family. Now, within the family, hindi mo maalis ang stigma. Hindi within the family, it's the stigma of the neighbors. No? The neighbors outside. No? Huwag mo na silang pakialaman because that will pass, you know? After some time, wala na yan. Hindi na kayo infectious. So ngayon nga, hindi na nga masyado eh. Hindi katulad dati, nilalagyan pa ng yellow ribbon outside the house. No? Yun.
Yes, okay. Another question from Mr. Brian Patricio.
Mhm.
Is it normal to be praning nowadays?
Yes,
Nice
it's normal.
question.
It is so normal to be praning. Di ba? When you have sore throat. Na? Kahit sa atin, di ba, Jude?
Yes.
So sore throat, oh my God, parang baka may COVID ako. 'Di ba? Or you have a slight fever. Parang feeling mo talaga, ako I cut clinic or I stop, no? Nag-absent talaga ako when I had a slight fever one time. Because even if you have no exposure, you can never say. So nagpa-swab din ako. See? Napapraning din
Ready ka
ako.
rin. So
'Di
even
ba?
doctors, no?
Yes,
Yes.
yes. It's so normal. It
Okay.
makes us perfect human beings.
Okay, so you hear that, Mr. Brian Patricio, you're just human. Okay. A follow-up question from him also, no? Can you comment po, Doktora, regarding being on quarantine is a torture?
Ay nako, super agree. That is true, 'no? Kung ikaw nga nasa bahay ka pa lang, hindi ka makapunta sa grocery or something, naiinip ka na, yung pa kayang nasa kwarto ka lang, okay? So, it's torture, true. That is the reason why um, I suggest, no, for hospitals, no, the dietary will put small notes, no, for those who are going to send the food, no, kasi wala na nga silang kausap, so meron silang notes. And then cell phones, no, we text, no, our healthcare workers who are
Workers.
admitted. Yes, we make regular messages for them. And as I mentioned the first time, we give like activity books or coloring books. In fact, kung meron pa akong book na pwede ko nang ibigay, you know, just to keep them busy, no, and establish a routine. For the younger ones, they do TikTok. May contest kami minsan ang TikTok kasi there was a time na marami sila na naka-admit. But right now, we're into a low census, thank God. So
Okay.
yes, it's true. It's a torture.
So it's parang they get the feeling na they are loved, they are taken care of by
Yes,
the
yes.
hospital, but
Mm-hmm.
by just merely texting them, how are you? Yeah,
Exactly.
sending
Mm-mm.
good quotes, etc. Okay,
Mm.
that's a form of therapy na rin ika nga. Okay.
Yes.
Ito, coming from a question from Dorothea Perez.
Mhm.
What about the trainees?
trainees,
Yeah, the
meaning
residents, okay,
residents.
oo, the
Okay.
fellows, okay.
Yeah. Siyempre, the residents and the fellows, kung scared nga tayo as consultants, what more
Mas
yung mga
more sila kasi
trainees.
talagang di sila pwede mag-absent, no?
Yes, no. So syempre, during the time that it was March, April, and May, no, the second year for IM, right? Second year, third year, talagang they had to really man the ER, no, the triage center. So talagang um, the scare is real. That's why nga marami nag-year gap, no? For those who are to undergo training this year, no? Maybe because they think that uh, the training will not teach them much right now because of this COVID. And of course, the scare of my getting the virus. No? So, you know what? One of the best things to actually lower down the fear is to make sure that you feel protected. So if you feel protected, getting used to the PPE every day, like if you are assigned to a COVID ward for the longest period of time, para bang nare-relax na sila. In fact, they already know the ins and outs. Wala na yung scare na magkamali ba ako kasi routine na siya. So when
Okay.
it becomes a routine that you're used to it, no, and you do it every day and hindi ka maglalax, no, dun sa procedures na ginagawa mo. You have to do it. Kahit na sabihin mo low census ka, you still have to follow the rules. No? Then the rate of infection that you might get will be lower. No? So, kailangan lang talaga training. Pero if you're new, syempre, scared ka pa. Tama ba yung
Yes,
pagsuot ka ng
oo.
gloves, you know?
Mhm. What about yung Tora na the trainees with less exposure? So do you think that it adds up to their anxiety na how will I be a good consultant kung right now wala akong mga exposure in
Mhm.
terms of skills or managing patients, so puro online. Siyempre, it's difficult. I
Mhm.
mean, it's different from online to the actual case scenario.
Yeah, that's true. Um, this kasi are, this is what I told you na parang these are things that beyond our control. Okay. So it actually does not make them very anxious, but it makes them less confident with the field they choose, you know. But remember, when this pandemic passes, which we know it will come, it may not be next year yet, but in the next few years, no, it will still be experience. Even if you graduate from a residency training with all the full training program, you still develop the skill of your field of practice. It's during your practice time. You can actually extend and volunteer for mentorship even after your residency or fellowship once the virus is gone. But syempre, that will take an extra effort from on your part. So para bang one step ahead ka rin pagka kunyari natapos na yung training, no? And then wala na yung virus, I would still volunteer and go to my mentors and, to add more experience and
Experience. Yeah.
confidence.
Or extending training.
Yeah. Yeah. It may not be the official number of years,
Yes.
but nagvo-volunteer ka, no? Parang nagsha-shadow ka pa rin.
Okay, okay. There's a follow-up question from Brian
Mhm.
Patricio. No? Is anxiety or depression triggered by certain factors? Like for example, this COVID-19 pandemic.
Mhm. Yes, anxiety and depression. Anxiety is actually triggered. No? So there are personality types wherein one person is a little more anxious than the other. No? Yung bang from childhood, medyo mas matatakutin siya. Personality niya yan. It's not a disorder, but some people are stronger than the others, right? Now, this may be triggered more by COVID and anything that imposes some danger on us. No? So usually kasi our sympathetics, no, our brain reacts to danger or a threat that we have. Hahabulin ka ng aso or masusunog yung bahay sa neighborhood ninyo. So it triggers all this adrenaline, no, para magpalpitate ka, manlamig ka. Okay. But what happens with anxiety is wala pa yung trigger. Wala naman pang reason for you to be anxious, but it's the mere anticipation that baka ako mamatay, baka hindi ako makabreathe. Especially if Dr. Google becomes the source, no? Like for example, a patient came in to me kasi daw may side effect. No, ang sabi daw sa Google, dapat daw siyang maligo from the feet, going up to the head kasi papasok daw yung lamig sa ulo kung dito. So syempre sumakit yung back niya, no? Kasi lagi siyang nililigo from the
Nauna sa
paa.
paa.
Yes, no? So, yung ganong mga information actually, pinapaniwalaan kasi, no? So, it will trigger anxiety to those who are prone to become anxious, no? Now, the mere fact that you're going to read, for example, the latest one now is the Lazada thingy, and then nagpa-deliver na dinuraan yung ganyan. Okay, we don't know which one is true, okay? So, but it will make you warning, di ba? Warning, watch out, yung mga ganyan. So, palpitate ka na ngayon yan, mga anxious ka. That's normal. But when it comes to a point that the fear becomes daily, no? Wala pang trigger, parang feeling mo palagi is parang nagpa-palpitate ako. You watch out for your breathing. Breathing is automatic. If you put your consciousness in breathing, it becomes difficult. Okay? So, pupunta ngayon sila sa pool mo. Nahirapan po akong huminga. Chest x-ray, ECG, normal. Okay? Then they end up in the psychiatrist. Kasi sasabihin ni pool mo, wala ka naman sakit eh. Di ba? So, yeah. So, it's because they're worried that they might have something. Kasi if you read difficulty of breathing kay Dr. Google, ala, lalabas lahat yan. Asthma, COPD, pulmonary emboli. Okay. So they get scared. Cancer. No? Yan ang most common kasi that they are scared about. So it makes you even more anxious. When your anxiety becomes daily and prolonged, then depression gets in. Because you feel that you are not understood by your relatives anymore. Kasi you keep on, para kung may ganito, dalhin mo ko sa ER. Sasabihin na nung asawa mo, ano ka ba, paulit-ulit na to. So, nagtatampo ka, nade-depress ka kasi naiinis ka rin dun sa mga nangyayari.
Feeling
So,
mo hindi concerned sa'yo.
yeah,
Okay.
yes, yes, oo. So, they're
Okay.
related actually.
Okay. So ayan. So I hope you'll able to get the explanation, Mr. Brian Patricio. Here's a question from Andy Santiago.
Mhm.
Uh, why do you think, or are the healthcare workers hesitant to seek professional help?
Um, because syempre ang healthcare workers are those who work syempre sa hospitals, no? So sometimes andun pa rin kasi yung stigma na, huy, ba't ka nakapila kay Doktora Bautista? Alam mo yun, 'di ba? So some would think na naku baka sabihin naman nila may tililing ako or praning ako or something. But you'd be surprised that now hindi na masyado, no? So usually when I'm going to end my clinic, yon medyo may pa isa-isang nurse na darating, no? They just actually talk with me, no, to tell me na may concern sila that they feel that they're feeling down. But kasi ang mahirap kasi sa depression and anxiety, you can actually make a face, no, na parang wala.
Wala.
You look okay, but deep inside, pag tinanong ka ng mga colleagues mo, "Huy, okay ka ba?" Okay lang, pero deep inside, parang kinakain na yung heart mo, no? So, seek help, you know? Because hindi naman kailangan agad psychiatrist. You can actually, as sabi nga kanina, you have to choose the people who will listen, no? And you know who will understand, no? So, not all people are skilled kasi to listen, no? So, dun muna. And yes, they're scared because of the stigma. Yun yung
Okay.
reason.
So in terms of stigma, Dr. Annette, no, so which is more
Mm-mm.
affected? I mean, sino ba yung mas parang recall this, mas nade-depress o parang gano'n, no? Yung in terms of the stigma, yung mga doctors ba, mga nurses, medtechs?
Nurses most
Kasi
often
iba,
kasi.
pag doctors yan, siyempre, ay, doktor
Mm.
yan, wag mong anuhin yan, wag mong tawag doon, wag mong bibiruin yan, parang gano'n. Pero other than doctors, parang mas sila at risk di ba? Sila mas
Yes.
naapektuhan in terms of the mga stigma na, ay, lumayo ka dyan kasi humahawak ng mga COVID patients yan. Eh, yung doktor din,
Totoo.
humahawak din naman ng COVID patients.
Yes,
Pero mas
actually.
hindi sila takot sa doktor, mas takot sila dun sa nurse, sa medtech, sa radtech, etc. Di po ba?
Mm, mm, mm.
So,
Totoo.
mas affected sila.
Yes, affected sila. Pero you'd be surprised, no? Marami kasing who consult or just talk with me who are physicians.
Okay.
Kasi
That's
na-affect
good.
talaga sila. You know what? It's not actually lang the COVID, it's the load of work. No?
Okay.
Especially those in the
Mga
rural
ano ba
health.
yan? Pulmo saka infectious.
Ay, kung paano
Saka
naman sila yung lagi
anesthesiologist.
tatawagan. Sila yung lagi. Diba? I mean, I would understand, na Pero ngayon medyo mas nagka-calm down na because para bang naging routine eh. Sanay na. But
Sanay
no
na,
March,
okay.
April, my God, talagang iyakan as in.
Especially yung mga news na yung colleagues mo biglang nagulat ka na
Totoo.
lang, 'di ba? So talaga I'm sure at one point in time mga colleagues natin din dumating din yung point na sino susunod? Parang
Yeah.
who's next in line? Eh? Parang sino naman yung mababasa ko na naman sa Facebook na si ganito wala na, etc. etc.
At saka nakaka-depress din that yung tao nyo sa area mo, let's say in your hospital, alam mo nagkaroon, tapos magkakaroon pa ng isa, nakaka-depress,
Yes, I
It's
agree.
depressing for the admin, it's depressing for the entire population of the hospital, yung staff. Kasi colleague mo eh. Sa lahat ng yung moral bumababa
Mababa.
talaga.
Yes, I
So doon
agree.
ka dapat medyo kailangan mag-support talaga pagka ganun.
Okay, here's a nice question, no?
Mm.
From Joanne Silva, concerning team managers. So siguro mga office-based ito, no? Sa hospital, okay?
Or middle
So,
managers.
yes, so how, what activities would you recommend, no? Para to boost the morale also, even though they are not exposed as directly as the nurses or doctors, but within the hospital sila, to, maintain, no, their sanity. Kasi
Yes.
especially they're bombarded with meetings, no? Everyday meetings, meeting 3 times a day. parang
Oo.
tablet na yan, 3 times a day yung meeting eh. So how can you, lessen or minimize yung kanilang mental stress? From
Oo.
Joanne Silva.
Yeah, alam mo, Joanne, yun ang mahirap talaga when you're office-based, no? Depression will set in because there's no boundaries between your work anymore and your home. So parang hindi ka tulad nung okay, nag-o-office ka, then by 5 o'clock, 6 o'clock, kahit pa nag-overtime ka, alam mong uuwi ka. But right now, because you're in the house, may tendency na, uy, nasa bahay naman kayo, bakante ba yung 7 o'clock? Sige, mag-meet tayo ulit. So this is not only for healthcare workers, this is for other companies, no? Especially with rank and file, no? So meeting and meeting, mga may quota na mga companies.
Reports. Oo, no?
Yes, and reports, no? So, kasi dapat kasi yan, there should be a meeting addressing concerns muna within that company. Like, magsa-start ang year ng January. What are the changes that are necessary to give some space for the middle managers, no? Like, for example, sa hospital, yung mga nasa accounting, business office, no? So, basically, ang iisipin natin, hindi naman sila pagod kasi wala silang exposure, di ba? But they also tambak ng mga paperworks because
Paperworks.
everything now is online. So pagka hindi mo nagawa agad yung PhilHealth mo, di wala kayong claims, di ba? So there's so many things that you consider. One thing though is also for example sa amin, we set up now a first virtual Christmas party Zoom for the employees. So this is not only for the healthcare workers, this includes the hospital staff, the accounting, all, no? Janitors, no? So not everybody will have the internet. So pwede silang on that area, nakaka-group sila siguro na 4 dun sa computer dun sa isang area. And then we also have raffles, no? This will be next week. So
Anong oras yan, Doktora?
oo, may raffle kami para sa kanila. So, parang it's just for them to feel Christmas, no? Kasi nawala eh. Nawala na yung, wala na kayong
Excitement.
excitement, di ba?
Oo.
No. Para namang appreciation. Another thing also is appreciation, no? Para bang for every area, meron kayong small Zoom happy workshop. Walang work. But you just like talk with each other, no? Do like kayon, Christmas party. Pwedeng hindi kasi pwede talaga gatherings talaga eh,
Yes,
no?
oo.
But it's very important that the admin takes note of the boundary between work and rest, no? they have to take note of that. Minsan kasi na-overwhelmed din sila because especially if you need to finish, no? You have deadlines, okay? But there should be like at the end of the day, o itong week na to magaan na tayo. You know? Para alam naman nila, meron naman tayong rest,
Yes,
no?
looking
So,
forward.
yes,
Oo.
yes.
So, most probably, yung question ni John is because siguro since online, so hindi na siya regular na 9 to 5, di ba? 9 to sawa.
Actually, yun yung nangyayari talaga.
No? 9 to sawa na,
Diba?
no? Yun ang nangyayari siguro. Okay. A question from Mr. Jerome Reyes. You
Mm.
mentioned po, Doktora, that uh, individuals resort to drugs, no? So are there any, I mean, do health workers also resort to drugs because they want to address the psychomotor, the psychosomatic symptoms? They want to sleep or alleviate fear?
Okay, this was a study actually abroad, no, in the US, the journal. No, I forgot lang I think it was Maryland. So that study showed, pero this is US, this is not Philippine.
Philippines.
Nag-increase kasi because yes, it was an outlet for them, no? And tayo, ang nagagamit kasi sa atin is alcohol because alcohol is considered a substance, okay? It's a drug. So, even with the alcohol ban, 'di ba, minsan yung pag nag-quarantine na yung mga 1 week, ganyan, medyo palusot-lusot ng
Palusot na.
pag-inom, no, 'di ba? So, syempre, so maybe it's also because ito yung outlet for them to speak up and oh, huli ka, unwind, gano'n. But sometimes you consider the risk also of drinking together, no? And one bottle kasi maybe one bottle in the beginning, and then it becomes two, and then it becomes three. With regards drugs, not too much for healthcare workers when you're talking about shabu, no? Hindi naman. But sometimes there's the need for like clonazepam, benzodiazepines, no? Na para lang makatulog. Not because naman magiging habit forming for them, but for the time na parang hindi sila makatulog, mas medyo madalas lang gumamit. No?
Okay. They have access kasi?
Um,
Madaling
well,
humingi ng
hindi. Kasi
prescription?
S2 kasi baka may
S2.
kaibigan silang doktor.
Yes, oo. Kaibigan
Yes.
na merong yellow pad, yellow
May,
form. Okay,
hindi
okay.
na kasi siya yellow pad.
Hindi na
It's
yellow pad?
S2. S2 lang,
S2 lang
triplicate.
nila. Okay, okay. So
Mm.
a question here from Melodel Santa Maria. Uh, are there, I mean, yung cases of suicides have increased? I mean, sa healthcare workers.
Oh, healthcare workers in the Philippines, hindi naman, I wouldn't say nag-increase, but it happens. No? So
Okay.
the well-publicized case of a doctor in the US who was an ER doctor during the COVID times because parang na-overwhelmed siya with the several deaths na wala kang magawa. There was an increase from the previous, but generally, suicide in healthcare workers is not very high. Okay. Ang mataas is suicide among the population. So
Okay.
right now there is like it's almost like 70-80% increase in suicide because of access also to social media of popular people who have committed suicide, and because hindi kasi sanay ang pamilya minsan na magkakasama. Okay. So, magkakasama lahat ng college students and working. So, ngayon, uy, work from home na and school from home. Uy, magkakasama. Okay pa siya nung first few months. No? Pagdating ngayon ng mga June, July, hindi na sila sanay na nagdadakdak si mother, no, na lagi ka na nasa computer, etc., etc., lagi kang naka-cellphone, tumulong ka naman sa amin. So, nagkakaroon na ng clashes, even between spouses, no? So, na minsan, nagde-depression yung mga young adults, no? And yes, nag-increase yun. In every province, and we are overwhelmed by the number. So, we are now forming with the help of a foundation. Well, it's the Unilab Foundation actually. We're helping a suicide prevention toolkit, which we will run, partnered with the Department of Education. But it's in the baby steps muna. We're still fine tuning it, no, and training the gatekeepers to help us assess and see sino ba ang pwedeng tumulong. no, for the psychological first aid.
Okay, okay, that's good. Okay, that's good. Um, a question or comment from Sherwin. We need to protect our healthcare workers, no, because they're
Yes.
overworked, especially for example, hindi darating yung ano niya kapalit.
Mm,
So mag-extend ng time. So maybe it adds up, no, to the mental stress. Okay, thinking na meron siyang mga kids, may papasok, magpe-prepare ng baon sa loob ng bahay, syempre.
ah,
So I, so I think yun yung gusto i-share, no, ni Sherwin. No, we need to really protect and understand our healthcare workers. Okay.
yeah. Alam mo,
Siguro ang
sure.
nangyayari, doktora, baka focus natin sa mga nurses kasi sila yung nakita natin eh. Unlike the medtech, kasi once they extract the blood, diretso na kaagad sila
Mm,
sa loob ng office. So baka siguro we need to also yung monitor there or check, no, yung mental health status ng mga health
mm,
workers natin sa radiology, sa pathology, etc.
yeah.
etc. No?
Mm, oo.
So
Ang
lahat po
problem
siguro.
kasi, it should be teamwork kasi within your area. So for example, you're in a ward, no? Let's say a dialysis unit or just a ward, no? Syempre, na pag kami nag-absent, alam naman niya and she's responsible enough to know na pag hindi siya pumasok, mag-o-overwork yung isa, no? So sometimes it takes teamwork, no? Syempre, unless talagang may ubo na, may sipon. Minsan nga, may
Yes.
ubo na nga, pumapasok pa
Papasok
man.
pa, oo.
So, pag ganon, um, it takes a good nursing service admin to handle situations wherein may backup plan kayo if ever. But to me, ang malasakit mo sa grupo mo, even tayo, di ba, no nag-residence tayo, in as much as I can, hindi ako nag-absent kasi naaawa ako dun sa papalit sa akin if I don't go to office, no, or to the hospital. So, yung bang conscience mo yung malasakit mo within the group, your working colleagues, no? So, pag ganyan, minsan kasi yung iba talaga lang may wedding na attendan, hindi magpapaalam, no? So, yung mga ganon, no? Kawawa talaga yung mga
Yes.
mag-overtime.
So,
Mm-mm.
so Doctora, do you agree na even our colleagues can also add to our mental stress
Yes. Yes, that's true, di
from time
ba?
to time, no? From time to time.
Oo. At
Okay.
saka hindi lang yun, Jude. For the nurses, minsan yung doktor din ang nakaka-add din ng stress sa
Yung
nurses
stress.
because probably mainit ang ulo ni doktor, tapos biglang sisigaw. So, nagkataon at that time, medyo down yung nurse, no? So, these are situations we cannot predict, no? Hindi naman kasi all the time naman, lahat ng doktor pare-pareho ang ugali. So, it would be nice, no, na before we let out a word, no, or anger, is to calm down. Ako kasi hindi ko ugali na magwala agad. Hindi ako ganun. Okay. But there's some, no, who are like that. So it stresses the nurses so much. No?
So, is it okay to be too sensitive nowadays? Parang related din sa question na okay to be praning.
Let's rephrase that. Okay. It's okay to feel para bang baka ako may sakit, baka ako mawala sa sarili. That's okay. Pero to be oversensitive is trying to work it out para you are able to handle the stress because we cannot remove the stress that comes to our lives. I always tell my patients, even if you transfer a job, no, kasi overwork ako dito na lang ako. Any job, whether you're a janitor, a teacher, a doctor, a nurse, no, or an engineer, there will always be stress. But if you are able to handle the stress better, no, meaning there's that certain sensitivity that you don't get into your heart too much. No? Sensitive, sinabihan ka na, ang bagal-bagal mo naman eh. Nakakainis ka. Yung mga ganon. So,
Yes.
syempre hurt ka, no? Iiyak mo lang. But that's just one person. You should believe yourself. You're not wrong or probably a little slow ka lang, then I'll improve the next time. It's like stepping stones and standing on the faults you had before to make you stronger. No? So, kailangan hindi lang oversensitive. Because pag oversensitive, we dwell on it too much. So, lagi na naman tayo mag-worry within the
Worry, yes.
day. Hindi na
And can
naman
affect
tayo.
other people with that.
Yeah.
Okay.
Mm.
So I agree with you, Dr. Annette, that we don't only focus on the healthcare workers na we usually see, 'di ba? So like yung mga janitors then security guards, they are also part of the hospital, and
Mm.
we need to let them feel na we care, not only na pinapaswab natin sila di ba? Hindi yung care yun di ba? May iba pa dapat, no? Just what you said, no, you have to talk to them and ask them, kumusta ka na, how are you? Kasi kahit sabihin mong sila yung naglilinis ng room, exposed din sila, no? Sila yung nag-screen ng mga
True.
pasyente, so exposed lang sila. So hindi lang po swab, no, ang ipaparamdam natin sa kanila, kundi sabi niyo nga po kanina, Doktora, konting haplos.
Oo, at saka ngiti. Tsaka minsan kasi, yung mga guards, for example, di ba, their masks sometimes are
Yes,
down. No? So, sasabihin ko na, Kuya, mask natin, warning number 1.
yes,
Alam mo na.
hindi
Because
hindi
you're
hindi
doing that,
memo, no, hindi memo.
oo, kasi you're doing that for them.
Yes,
No? It's for them kasi sa kanila dumadaan yung mga tao. Baril ka lang ng baril, 'di ba?
yes, oo.
Temperature.
And it's a way that you're showing them na you care, kaya sabi mo na, kuya, yung mask, okay, ayos mo, okay. There's a comment, from Joanne. Okay. Nakakaiyak po, Doktora, ang last slide niyo at yung message ng last slide. Okay.
Yes, Joanne, favorite ko yan. Sometimes when I feel down, normal lang naman ako, so I feel stressed out because ang dami kong webinars. Okay.
Wow,
I feel stressed out. No? So, at saka I have classes hanggang 7 p.m.
Yes,
Sometimes
online,
yung
no?
clinic ko is so long. No? And talking to many people can also drain you. No? So, ang inaano ko lang is I keep that saying in my brain na if I worry too much, it deprives me of the joy. No? So, I just pray actually in the morning na, Lord, just keep me going today. I trust ko na lahat ng worries ko na. Tapos pag uwi ko ulit, sabi ko, Lord, nag-survive ako. Thanks. Ganun lang, you know. It relieves you somehow, you know. Mm-mm.
So I think ventilating your feelings is very important, no? If you came from duty, pahinga muna siguro, no? O wag mo munang sabihin na toxic ni doktor na ganito, toxic ng kamag-anak ng ganito. Pahinga, then after that, kwento, no?
O
Pero
manood
not
muna
to the
ng
point,
Sharon Cuneta.
oo. Kwento, share lang, pero not ask opinion na tama ba yun? Tama ba yun? Kasi kundi, magdidiskusyon kayo sa bahay, di ba? Lalo na yung husband and wife, di ba? So that's very important. Okay. So I guess wow, sorry doktora, naubos kaya tang time niyo.
Hindi naman.
Nag-extend tayo masyado. Anyway, ano naman 'to last, 'di ba? Save the best for last, ika nga. So again, Dr. Bautista, thank you very much for graciously accepting our invite for the last watch party of the Philippine College of Chest Physicians on mental health. Okay, so thank you very much. Sana po, again, lagi ko sasabihin sa'yo, sana po lagi kayong available. Sana lagi kitang maharas.
Anytime.
Okay, so I'd like to leave you with this message. So let your smile change the world, but don't let the world change your smile. Okay, so with that, thank you very much. Advance Merry Christmas. Stay safe and be safe. Thank you, Dr. Bautista. Ate
Thank
Annette, thank
you.
you. Okay.
Kuya, happy holidays.
Happy holidays. So, thank you,
Okay.
Joanne. Thank you very much.
Bye-bye.
Bye-bye. Bye-bye. Again, we'd like to thank our partners, UAP, Valuing Life and Breathe Freely, and of course, Novartis.
Thank you.
Thank you very much, Ate Joanne, Ma'am Joanne.
The world we once lived in is so much different from the world today. We are now faced with newfound challenges that we hope to overcome. Amidst the uncertainties and doubts, we wield the armor of hope and continue onwards. Protect the health of our people by preserving the land, the seas, and the air we breathe. We journey forth this treacherous path with courage and love, armed with a passion to heal every man, and with hearts and kindle, heal the world.
There's a place in your heart, and I know that it is love. And this place will be much brighter than tomorrow.
And if you really try, you'll find there's no need to cry. In this place, you feel there's no hurt or sorrow.
There are ways to get there. We care enough for the living. Make a little space, make a better place. Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me.
If you want to know why, there's a love that cannot lie. Love is strong, it only cares for joyful giving.
If we try, we shall see. In this place we cannot feel fear or dread. We stop existing and start living.
Then it feels like always love's enough for us growing to make a better world, make a better world.
Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me. And the dream we were conceived in will reveal a joyful place. And the world we once believed in will shine again in grace. Then why should we keep struggling life for this earth has a higher soul? Though it's plain to see this world is never need big or small. Somewhere over the rainbow, blue skies fly. Birds fly over the rainbow, white and so white and high.
If happy little bluebirds fly beyond the rainbow, why, oh, why can't I? We could fly so high, let our spirits never die. In my heart, I feel you